Yeah. So there you go, Bree.
Thank
We'll
you.
sign it. Yeah. Are you grinching or what? Because you're like, oh, you're skipping Halloween?
No, usually around this time, I'm already making plans to go and make my vacation plans to go visit my parents. But I don't think that's happening this
A
year.
little different this year.
Yeah.
That's 819. We wanted to go over the virus numbers real quick, Bree, before we get to
Right.
Lieutenant Governor.
So, according to the latest numbers out of the Joint Information Center released last night, 719 samples that were ran, 92 returned positive for COVID-19. Guam's total COVID case count is 3,170 people. 921 island residents are actively fighting the virus, while more than 2,100 have recovered. There are 62 COVID patients that are hospitalized at the Guam Memorial Hospital. 10 are receiving ICU level of care. 0 COVID patients at GRMC that are hospitalized. And there are 3 hospitalized at Naval Hospital in Agana Heights, and 2 of them are in ICU. And those are the latest numbers from the Joint Information Center.
All right. That being said, let's go ahead and bring up Lieutenant Governor Josh Tenorio. If you could, LT, just maybe comment on these numbers that actually continue to rise, and we haven't seen any flattening or any plateauing of either the positive cases or the hospitalizations. An all-time high in hospitalizations at the Guam Memorial Hospital. How is this hitting the front office down at Adelup?
So first thing I would like to say is good morning. The situation at the hospital, and we met with the folks on Zoom yesterday. I'm just trying to understand. Of course, there's been, with the last couple of weeks, we were in the 60s. We're seeing part of that population coming in. But also, there's been a drive from the medical providers to try and get people with symptoms to come in a little earlier so that they don't get into a bad way. And so what you're seeing is that you're seeing more people hospitalized, but less people on ventilators. And we're trying to keep the number of the people on ventilators as down as possible. So there's a coordinated outreach going on with private health providers trying to identify, including through the public health surveillance system, those patients that need immediate medical attention and for them not to wait. That's on one side. And the other side, and I heard that you had a little discussion about this yesterday. There's some extensive outreach going on and expanding, trying to reach communities up in the north and going in and trying to be a bit leaning on testing. These are the people that have limited access to healthcare, maybe some transportation issues, and we're seeing a really big spread in those groups. So those are the two things that we can do to try and push the numbers, but the numbers are not encouraging. Clearly, they're not encouraging. And then on top of that, there are about 488 kids from 0 to 19 that have turned positive. Fortunately, many of them are not as sick as the ones with the health issues, but still, it is a big issue that we're looking at, especially since there's a lot of pressure and discussion about preparing for a place in time or point in time when we can consider returning to face-to-face instruction. Those are all big factors that are all being looked at right now. There is a lot of pressure, I'd say, and the private schools are wanting to open already.
Right,
and I've been working with meeting with the superintendent and the education subcommittee. They've made some recommendations to public health for additional guidance to try and address the community spread issues. But we're not there yet. Yeah. We're not there yet. And the other thing is trying to make sure that public health and their system is going to be able to be responsive and have a rapid response to if and when cases show up in the schools when schools are in session. That's kind of like some of the things that I've been looking at over the last days.
Right, LT. Oh, go ahead.
No, I want to just go back into that 0 to 19-year-old seeing spikes there, but you're also seeing double-digit increases all the way from 0 to 50 to 59-year-olds, and more particularly in the 20 to 29 year old age demographic, where there were 42 positive in just the past 3 days. What's being done to address those demographics and those numbers?
and that's the biggest challenge because a lot of that group, the studies would say are asymptomatic or have very mild symptoms. They think that they're pretty invincible and healthy, and they're not getting out. They're not kind of following the public health protocols as much as we like. So we're seeing, they're getting it either in the community or at work, and they're bringing it back home. We have a lot of families and multi-generational households where those are the people that are susceptible. So part of it is messaging, but part of it is also trying to reach them in different ways, different languages, to try and push it down. But it's troubling for here. It's troubling in the country, and that is the biggest area of the spread. You could tell a lot more work that needs to be done there, Bree, and quite frankly, what helps are the messaging from the media, but we need to just try and reach more. One criticism, and I've heard recently, was, well, the JIC reports are too long. People are not looking at them. Make the messages or the reports simpler. Many young people don't realize that they're the first top group for positive, and that's something that I think we need to do a better job at.
We had a comment here, LT. The legislature should have put fines on violators when they had the chance.
Well, I think members of the business community have been asking about that recently. That is still an open issue, and it really is going to be up to them to figure out whether or not they're going to balance the need to try and put some fines and penalties, some civil penalties for this kind of reckless behavior versus, the opposite side of the coin. Because we have, unfortunately, there are a lot of people with different views. People are there are no maskers here. People, have COVID fatigue. They don't want to follow. And those are the different pressures, I think, that are in the minds of the legislators. I'd encourage them to consider the legislation. Whatever they feel that they are comfortable doing would help.
LT, that being said, this week, we haven't had that press conference, but what are we anticipating as far as any easing of any restrictions or any walking back of anything that is in place now? And I know these announcements are usually made by the end of the week. We didn't see any movement last week because of these numbers. They're still the same numbers, still the same story. So what are we doing this week?
I don't have any, right now, I'm not tracking any change yet. I mean, we have a meeting in 5 minutes and we'll continue to be monitoring it, but I'm not seeing any movement. There's been pressure. Some are pressuring for further occupancy and retail and et cetera, but it really is going to be dependent on the confidence level we have that we can deal with all the folks that are really sick at the hospital and on the healthcare front.
I wanted to ask.
I wouldn't rule it out, but right now I'm unsure. I'm unsure. It's still a very moving situation and really trying to get in the weeds. And then, of course, this week we have additional help. We have, I think, 5 additional officials from Center for Disease Control that are on Guam. They started yesterday. They're digging deep, helping us further refine and report on the data of all of the positive cases. In some case, it's affirming some of the activities that we have planned, including the extensive outreach going on in the north, including getting into the minority communities that are showing greater signs of infection than others. And then even educating people, about all of the different mitigating measures that can happen as businesses have opened and mobility has increased. Those are all the things I guess that are factors right now.
The visit from the CDC, was this something that public health or the government said, can you guys come over here? Or was it something that the CDC saw with what's happening on Guam that prompted them to come here to see what's going on?
No, we asked for them. We asked for additional epidemiologists to help on the data side. We also asked for some of their experts on the contact tracing side. They're in with our teams as we expand contact tracing and push folks that have been trained into the contact tracing and surveillance side. And then there's also folks that are on the program side that are helping and making sure that we can improve responsiveness. There has been, the private providers have been talking with us and we've been working with public health to try and cut down the response time, especially from those folks that are testing positive and being notified initially by the medical providers, and making sure that, and we see it's really trying to respond fast enough so people who are tested can quarantine at home, and if they're positive, then isolate. The other thing that we're doing is we're really asking public health to go in and make sure that the folks that are positive, that are staying home, that are in home isolation, really should be there, and being a bit more forward and offering them accommodations elsewhere so they can contain or prevent the spread in their households. Chris and Sabrina, there was one case that public health talked about just the other day, where it was an employee that came home. There are 22 people in the household, and out of the 22, 14 got positive. So part of the reality that we're looking at when we're doing the outreach and the field work is really looking at those homes and those settings where there's a large number of people, many of them are poor, that are living in those conditions, trying to test them and trying to get them safe and into isolation when they test positive, and protect everybody else in the families that are not. Some of them, I've heard of one where there was a cluster of 3 homes with 40 people in those homes, all of them related to each other. And so those are the things that trying to go out, we have the National Guard and the Surgeon Cell helping. We've also have been providing additional support to public health. So for example, we've sent people from the clearinghouse. We have logistics planners that are helping public health expand and on the contact tracing and surveillance front, given the fact that we have so many people. I mean, you heard the numbers, 900 people are in home isolation. Those are positive cases. And it is a big number for us to deal with. But I think pushing more in and expanding the number of people is going to help. And then, of course, this technical assistance that we're getting from CDC, I think, is going to help us refine what we have. But I would say that there are other challenges, I think, that we're addressing. People, it's a demand for positives or contacts of positives, making sure that they get their testing very fast.
How see people going to be here?
They're going to be here for 30 days. It's a 30-day deployment. Right. And they started boots on the ground and at work yesterday.
Going back to what you were talking about regarding isolation, are we going to see another isolation facility open? And I know we had Charles Esteves on here a few weeks back talking about if we do, it would be more of a consolidated isolation facility. Has there been any movement on that?
We're tracking the numbers, and we have, I guess, additional facilities that we can put online. But yes, if we need additional isolation, we will for sure secure it and get it.
Okay.
I wanted to switch gears here a little bit, Lieutenant Governor, and see if we could get a comment out of you. That audit that came out from the Office of the Public Auditor. This was dealing with the Liberation Day, the big one, Liberation Day Carnival last year. I know that you were the chair. So I guess just first of all, what's your comment on that audit, which found that there were a few $100,000 in questionable
$300,000 in question costs.
Right, question costs. And then we also had some questions about some of the costs that weren't questioned. But if you could just give us a statement on the audit and the findings.
Well, I sent in, I guess, a letter agreeing with pretty much the audit. When we came in and we worked with the mayors, they had been expressing their kind of struggles over the last few years, and we told them we'd help them. We'd go and raise money and identify sponsors so we can put up a really, dignified and really good celebration for the 75th. but you were very happy that we did. But it pointed to some, I guess, longstanding and material shortcomings in in the mayor's council. And I guess from the mayor's council perspective, they're really having a hard time trying to apply the procurement rules to certain things. But that being said, I would say that I generally agree with the audit findings, and to me, it gives you a map for what you need to improve. The public auditor recommended that the law change so that the mayor's council of Guam can be relieved of that responsibility, and I support that. There are some ideas about where it will go, but I think we still need to talk with the legislature about where they think that it should go and how we should do it.
I know that we had sent a FOIA on all this stuff last year, and we found that among the contracts awarded for the Liberation Carnival was for ground cleaning and trash removal, and that was awarded to Comfort Cuts to the tune of, I think, about $12,000. And then there was also another security contract that was given to Sanku LLC, DBA, I think Supreme Security Services. But both these companies connected to your sister and the former chief of staff to Senator Pito Talahi, Teresa Tenorio. So we had found that she had signed off on some of these checks, and given the contracts and the appearance of impropriety, can you say that you had nothing to do with the awarding of them, or how would you address that? It just seems a little too close to comfort when your Niao's businesses are getting a good chunk of these contracts, or did.
Well, I did not participate in the procurement of this, and if he wants to go and compete for business, win or lose, then he will be able to do that. But anything that will be under my direct control, if I have procurement authority, if I am providing direction, then they would not be eligible for those kinds of things.
Right. I mean, but do you kind of admit that it does look a little
the appearance of, yes, I think some people would say that it doesn't smell right, but I just want to assure you that I have not participated in direct procurement of that, nor do I direct the procurement of that. But I do understand that people might see it a different way, but he can go and run his business without me, and I'm going to do my job without them. So that's sort of how it is.
Well, thanks for addressing that, LT. That's one thing I can appreciate about you is you come on and you answer.
No, well, thanks for giving me the opportunity, actually. Chris and Sabrina, I mean, sometimes with the lieutenant governor, you don't get very many opportunities or sometimes many people don't care what you think because you're really not driving the bus. But thanks for giving me the opportunity to come out. And I just want to, again, tell the people of Guam, we are in a critical situation. There is a lot of stress. Over the last few months, we've been trying to push out some assistance to to businesses, to people. We pushed out about $32.7 million for direct business aid and for sustenance and for public health to help those in need. And we still have some coronavirus relief funds. I know the governor has been asking Gita to come up with a refined strategy and for additional help for businesses. And I know Senator Shelton has passed some legislation trying to address the gap in the stimulus funds. But I just want to assure everybody that we will do the best we can. We're not perfect. There are things that we can improve, but we will work every day very hard to try and make sure that we try and move to normalizing our lives as much as possible. So thank you.
I wanted to ask about, you talk about how this is a critical time, and, obviously it is. But then there's this situation that happened over the weekend where there was this restaurant slash bar that had this Oktoberfest event, and you saw a lot of people not wearing masks because obviously it did not appear to be following PCOR 1 guidelines. When you see that, I mean, how does that make you feel? I mean, you guys are trying to do your best and trying to promote, hey, everybody be safe, but then you see something like this. I mean, it really is frustrating. And I don't know what you would like to say to address that.
Yeah, it's frustrating. Uh, I would tell you that unfortunately, when we see the leader of our country almost doing the same thing, it kind of enables some of that. I tell you what, the admiral had a phone call with the governor yesterday. He was very interested in the situation up there. I know that regulatory agencies are trying to make sure and reach out to that business so they can comply. You have a limited occupancy even for an outdoor environment. And I'm very disappointed that the business owner really didn't seem to be too concerned. Uh, looked at everybody, he thought they looked fine, and he decided he was just going to go with the flow. I think it's very irresponsible. It's tragic. And if you look at the numbers and you see there are, even though a lot of these young people could be asymptomatic or not as sick, when you're reading the literature, there's long-term health consequences that can happen. You might not know when this happens. Even for me, having survived it, you know, some of the NBA players who had it originally are having some heart problems. So it's no joke. And I just ask people to, make amendments. And Sabrina, where it's really hard for the local community, everybody loves to visit their families. So they're going to barbecue or they're going to go visit Nana. That is how the transmission is happening. I just wish people would please pay attention. And even when you feel that you're in your privacy of your mom's home, wear the mask or stay away. Try and limit your time.
Right. The chamber, they're holding this unity community rally tomorrow. You have any message for them?
Just that we will continue to try and do our best. A lot of the businesses, they're dealing with rent. They don't have the income to pay the rent that's due for the businesses that have been closed. That's something that we're looking at. But I will watch. I'm listening to their message. I'm hearing them. People are hurting, and I want to help. And I'll try and figure out ways that I can help from this position I've landed in, and try and help the governor meet those demands.
And I know we asked you about this last week about Halloween. Are you guys going to be putting out any recommendations to the public about, don't go out there and go home to home and trick or treat?
Yes, we've asked the public health and the surgeon self, they can come up with some good recommendations for people. And it's going to be helpful if I'm reading between the lines. I think based on how you guys have good ideas, I'm probably seeing that there might be some good stuff you might be doing, and maybe some other businesses, the media might be doing to be able to do this in a very safe way. But I'll get an update, and I would expect them to be coming out soon, trying to give some guidance on how to do Halloween in a very safe way.
Okay. Well, thanks a lot. LT, any final message to the people of Guam before we let you go?
Please, again, adhere to the public health guidance. Please try and make these adjustments in your life. The virus is out there. The minute that you have a symptom, please go to your private provider or public health and get tested. Don't take it for granted. Those that are sick, that are having problems, I would just say, monitor your oxygen levels. Don't wait till it's too late. Come more sooner than later so we can get you the help.
I'm so sorry. Update on the homeless shelter.
Yeah. So, we had a positive case in the last week. There's additional positive cases. I've just been told. I don't have the details yet, but I'm assured that positive cases have been taken to isolation, and I know that the National Guard has an operation to sanitize. And Catholic Social Services is I guess stepping up their monitoring efforts, trying to prevent visitors from coming in, because sometimes the virus, it was somebody returning. And so that's going on. And then this week we'll be looking at all of the findings that we've had so far. Every week we've been getting agencies and nonprofits to really identify the things that will map out this next phase of our strategy. Procurement ongoing. I don't have a report yet from GSA about them securing a second shelter, but the pressure's on for that to happen. And as soon as that happens, we'll make an announcement.
Okay. What was the total positive? Is this a global dorm?
Yeah, there's more than the first one that was reported. I don't have I'm going to get the number in the next few minutes, and that should be out soon.
Okay.
I'm trying. I don't have the exact number yet. I'll get it.
Okay. All right.
Thank
All right.
you.
Thanks.
Thank you, LT.
you.
Okay.
Off day, Governor G.
Oh yeah, you
Hi,
wanna?
my favorite
Hey.
Lieutenant Governor. Great job. Thank you.
All right, there you go. Thank you, LT. We'll be back with former Governor Carl Gutierrez right after this. It's the link on the breeze 93.9, proudly brought to you by Carrier at 647 Cool. Good morning.